Omo, things dey sup for dis country o. Haba, aunty, how you go tell me say you never knack one before? Pregnancy test dey show 2 lines. Omo, make you check am na, wetin dey sup? Welcome to Soso Podcast. I'm a registered nurse, health educator, the founder of Best Touch Care Foundation, and the author of The Complete Women's Health Guide. If you have not gotten yours, check my bio in LinkedIn. Today, we are exposing a silent killer, lying to your doctor. With me, I have a medical doctor who have seen it all in the medical field. Please, ma, can you introduce yourself?
Hi everyone, I'm Dr. Comfort Kubani Solomon, and it's my honor to be here with you.
You're welcome, ma.
Thank you.
So you have seen it all with your experience talking with patients almost every day. So, has any patient look you in the eyes and lied to you about their health history?
Of course, people lie in the famous words of Dr. House. Patients lie. However, before I even share any of my experiences, I want to beg you. Any complaint you have, there's a very high chance you've heard worse. There's a very high chance we've seen something more intense or more complicated. The hospital is not a place where you'll be judged. It doesn't really matter. Your health is priority. So to answer your question, yes, indeed, a lot of patients lie, and I believe that is because our society creates the pressure for people to present themselves in a certain way. But if you're sick, you're just a human being coming to meet another human being, and you should be able to come as you are. You mind if I share an experience I had?
Why?
So the first one that comes to mind is there was this lady. She came in to the emergency with severe abdominal pain, and in women, one of the things you have to rule out is ectopic pregnancy. So of course I asked her, "What was your last menstrual period?" And she said it was a week ago. And I confirmed the date, and she gave me an actual date. And I was like, okay, pregnancy chances reduced. And went on to collect other things, and I started giving her medication, gave her something for pain. Thankfully, it was in a center where we had access to an urgent ultrasound scan. So we sent her in for that and came back with, very strong heartbeats.
Wow. Wow.
So I was like,
Things are happening.
from where to where, ma? And I figured, she later told me that, oh, she's sorry, she hadn't seen her period in 2 months.
Oh.
And I was upset on her behalf because you could have, if I had just taken your word for it and decided not to investigate further, you'd have put the both of us in trouble, and you might not have been there to
Honestly.
witness the trouble because, but thankfully, and she explained that since I know her, I've had some rapport with her in clinic before. I know that she's married. I know her husband is not in the country. What's my business? Where did you see who named me judge over you? My goal, my purpose there is to keep you alive and keep you safe. And we're not soothsayers. If you don't tell us the truth, there is very little we can do with just what meets our eye.
It's so funny I had a similar experience.
Are you serious?
Yes, it was so crazy that this patient preferred than to tell the truth.
She prefers to lose her life.
I'm
Anyway,
telling
that's
you.
what we see. That's what we see.
So I'm thinking money issue, cultural, religion, or there should be something that is making them act this way. What do you think?
In my opinion, people lie because they have something to lose in this kind of setting, right? So, generally speaking, people lie for different reasons. But in the hospital, I think people lie because they have something to lose. Maybe they lose funding from a parent, they lose a relationship with a partner, or they lose standing in certain social circles if certain facts about their lives or their history comes out. So I don't think there is I think we can pin it to one particular factor. A poor person would lie for a different reason than a rich person, but people lie when they have something to lose, and that cuts across ethnicity, social status, and so many other factors.
Okay, going forward, I feel each person they are more relaxed, they can open up concerning their history. So, is there a way we can make them comfortable, just like your name?
Yes. If you're with comfort, you have to be comfortable, right?
Yes.
All right, but in a more serious note, first of all, I would say reassurance reassurance, and more reassurance. You can't reassure a person enough. And secondly, I would say do not punish patients for the truth. Because so let's start with reassurance, right? Um, when I want to ask a sensitive question in my own practice, I start from by reassuring the patient that this conversation is very confidential. The biggest one for me, I believe that patients need to be reminded and reassured over and over again that their consultation and whatever it is that they share with healthcare providers, we are obliged to keep secrets. So if they know that whatever they say is not going to leave the room and it's not going to affect how they're perceived outside, I think they'll be more willing to share. And so, anytime we want to ask a delicate question, for example, a teenage girl, if you want to ask, oh, have you had sex before? That reassurance coming prior to the question. Second thing is don't punish patients for saying the truth. We hear shocking things as part of our work. So when a patient shares a particular detail about their history. Oh, I smoke 3 packs of cigarettes a day. Neutral expression. Okay, thank you for telling me that. What brand do you smoke? Make the conversation as natural as possible. Oh, I have 15 sexual partners. Oh, okay. Are they all female?
Something.
Or something like that. You
Yes.
see, what I did now was really, really wrong. But we need to train ourselves when we like, interact with patients, they are being vulnerable, they are bearing themselves to us. We need to make sure that we don't punish them for the truth. We remain neutral and professional, and that will encourage them to share more.
That's very true, Dr. Comfort, and I agree with you.
Yeah.
Then patients should know that their confidentiality is their right,
Yep.
and we are not doing them a favor.
Exactly.
And for healthcare workers, they should know, patients should also know that they keep their record and anything they tell us is safe with us. We don't decide. Thank you very much, Dr. Comfort, for gracing this podcast. And
You're welcome.
I believe we can do it some other time again.
All right, let's do this again.
Thank you. You've heard it all. What we are doing. Share, like, and comment. See you next time. Bye. Clock it.